Hey there, Myo family, and welcome to episode number 6 of the Myo Minute. In this episode, we are going to be talking about a frenectomy, the actual procedure itself. I've spent a lot of time talking about tongue ties in adults and children. Now we're going to talk about the release itself, okay? First, who I am Carmen Woodland. I'm an oral-facial myofunctional therapist. In the essence of time, because I have a lot of stuff to cover in this video, I did a great intro in the last episode, number 5, about myself. So if you're curious about me, my expertise, my background, that kind of stuff, I encourage you to check that out because I want to get down to the nitty gritty. So in this episode, I've made some notes, guys, about what I'm going to talk about. The reason I chose to use this topic at this time to kind of wrap up Tongue Tie Month was that I get a lot of questions about the actual procedure to release a tongue tie, okay? So it looks like 1, 2, 3, 4, 5, 6 things I'm going to cover quickly so that I don't have anybody's eyes glaze over. Okay, for the first thing, frenectomy, frenotomy, frenulectomy, potato, okay? They're all the same thing. They're all going to be dealing with the release of that tethered oral tissue. Sometimes people in other countries or different trainings, that kind of stuff, they use different terminology. It's really similar. So before I talk about who does it, just for those of you who are new, so a tongue tie is when there is tissue underneath the tongue. It's too short, it's too thick, it's in the wrong place. It causes restriction all through the body. So I'm not going to dive into the long-term consequences of ignoring a tongue tie because you can go find that in some of the other episodes. But I just wanted to share that with you in case you're going, what is this procedure? What's a release for? So somebody, the WHO, can be a periodontist, it can be a dentist, can be an oral surgeon. I don't see a lot of that. It can be an ENT. I also don't see a lot of that. Generally, we are encouraging somebody to see a dentist, maybe a periodontist. The biggest thing is somebody who does a lot of them, okay? We don't want to have a release done by somebody who does them on kiddos, but sure, get in the chair, we'll do it for you, okay? So there's some different professions that do it. I personally have had conversations with periodontists who say they don't do enough of them to be comfortable with it. And then other times doctors say, oh yeah, I do a lot of them. So those are definitely questions that you will ask your provider. So we've talked about what it is, who does it. So what's the best method? I get asked this a lot. Laser, stitches, scalpel, scissor, whatever combination thereof. You guys, it does not matter necessarily the technique. What matters is the brains and the expertise and the understanding about the tongue tie, okay? I can speak a lot about dentists. Obviously, I was a dental hygienist, so they all know how to do this in school, but most of them shouldn't be doing it because they haven't done it in with enough frequency to be very, very good at it. So it's not really about their method. It's about what is up here, what they know and understand. Do they require myofunctional therapy, which is very valid, which is very important. Do they look at you like you've got 14 eyes when you say, hey, do I have a tongue tie? What is myofunctional therapy? I met somebody this week who said her doctor laughed in her face when she talked about having a tongue tie, having myofunctional therapy, and all of it. It laughed about airway ortho. So those are big red flags that it's not the right provider. So when you're looking for somebody to do it, you want not to be so worried about their method, but why do they do that method? Can they justify it? Next, what is the recovery like? So what's the pain, time off of work, that kind of stuff. So first things first, you guys remember, I don't have a tongue tie. I haven't had a tongue tie, so I haven't had this done. I live vicariously through all of my clients. Pain level is going to be different for everybody because everybody has a different pain threshold. I have had some people who I thought were really going to struggle because they have a low tolerance for pain, especially people who don't sleep well. They feel like a toddler who needs a nap. Sometimes those people struggle, but you guys, it's a minor procedure. It can be uncomfortable. Yes, I'm very aware of that. But I have had clients who get upset that I didn't tell them it would hurt so bad. And then I have other people say it wasn't bad at all. So pain, definitely going to vary. Time off of work. Again, everybody's healing journey is going to vary. I have most of my clients will have it done, like on a Thursday or a Friday. They rest through the weekend and then they're good. Other people, I've had speakers, singers, authors, people who are really out in the public eye. Sometimes those people will take a week off just so they can be sure that they're nice and healed. Sometimes when you have a release done and it can make your speech really slushy or you'll feel like you have a lisp. It also makes you real slobbery because salivary glands are stimulated by movement. So suddenly people are like, oh my God, what do I do with all this slobber? Okay, so that's something to think about. Otherwise, there's not a huge recovery time. You will heal, up to a month. Again, everybody's different, but that immediate tenderness is going to be within the first few days for sure. Is it necessary? This is another common question. I think that a frenectomy is necessary if it is causing impairment, which is 99% of the time. That's just my experience, the facts of my business. And then last, what happens after the release? So this is when the rehabilitation stuff starts. So many people don't want to have a release done because of pain, maybe money. I think pain is the biggest thing. And then also because what happens after. They don't necessarily want to do the work after a release. You don't get a new knee and sit in the recliner. You've got to do something. Okay, so we've got it moving. Now what? You need to get the tongue in the right place because it is a complete rudder for the body. So super duper important. That's when we work on fixing the tongue thrust swallow. That's when we really hone in on a lot of these things that we have gotten started prior to preparing for a frenectomy. In my practice, we start focusing on posture, breathing, and strength and coordination to get ready for the release. Then afterwards, man, we have got to do the work. Tongue posture, nasal breathing, all the swallowing things, all of that stuff. So just because you have a release does not mean that you're done. You now have to rehabilitate. So those muscles know how to work. Okay, so last, where you want to find more information, all over my social media, you will find tons of stuff about tongue ties. Remember, you can email me, thetonguetrainer@gmail.com, if you want your question to show up in one of these informative videos or maybe an episode of the Myo Minute. And I think hands down, the best place to start is with an exam. You can also download your Getting Started guide. That is going to give you a self-assessment tool. So you can go down the 25 questions, check off the things that relate to you, and then you can kind of say, I think maybe I have some concerns here. At the end of the day, if you think you have a tongue tie, there is no better way to have it identified than with a comprehensive assessment, because it's not about sticking your tongue out. It's about the function, how the muscles work. It's about tongue posture, nasal breathing, what's the swallow like, all of that kind of stuff. So that is it. I hope that's helpful. If you found this helpful, share it, give me a thumbs up, and I will be back next week to answer another hot topic, important question. Bye, I'll see you then.